Commission, and I want to thank all of you for joining us this morning for our public hearing. So our format today, I'm going to go over a brief presentation about the services that we offer through the Area Agency on Aging. And I know we're scheduled from 10 to 12, but I am not going to talk. I promise you my presentation is not going to be 2 hours. My presentation is rather brief. I want to give you an idea of what we do here at the Area Agency on Aging, but the main purpose of this public hearing is to give you an opportunity to give us some input about our service delivery system. It's your opportunity to give us your opinion on what we're doing well, what you would like to see more of, and ways that we can work together to improve our service delivery system to make it the best place for older adults and individuals with disabilities and family caregivers to live and thrive. So that's the purpose, and that's the most important thing. So I want to make sure that there's plenty of time after my presentation for you to ask me any questions you might have and for you to have an opportunity to give me some input. Now, we are going to be recording the public hearing, and there will be an opportunity outside of this meeting for you all to still weigh in. If you want to send us comments via email, you'll have an opportunity to do that as well. But I am hoping that we do get to engage in some dialogue this morning and give you an opportunity to provide some feedback. Okay, Darlene, I see you got your hand up and I saw your comment. You said you can't hear me. Is everyone having problems hearing me?
I'm hearing you fine.
I hear you fine too. This is Jane from Bryan.
And I can hear you on this end.
I can hear you.
Okay, so Darlene, we've got folks inside my building and outside of my building who are saying they can hear me fine. So I am assuming it must be something with the audio on your end. So I am going to go ahead and move into my formal presentation, that part of the public hearing. And so I'm going to share my screen and pull up my PowerPoint presentation, but I wanted you all to have an opportunity to see my smiling face and to say good morning. And before I move into my PowerPoint, some of my staff are also in the public hearing, virtual public hearing. So I'd like them to have an opportunity to introduce themselves. If you guys don't mind, please say who you are and what you do for the Area Agency on Aging, so everyone has an idea of who's here.
Yes, my name is Laretha Jenkins, and I'm the Wellness Program Manager.
I'm Marsha, I'm the Fiscal Analyst.
I'm Peggy Lukanen, and I'm the ADRC Program Manager.
I'm Mari Battle, and I'm the Care Specialist / Case Management Supervisor.
Okay. And I think I also have Alberta Taylor, who is my all things important. She's our IT specialist. She's our special projects coordinator. She's also on the background helping with me out today. And also Latrice Barnett is with us as well. She's the newest member of my team, and she's our admin and data entry clerk. So, okay, I am going to open up my PowerPoint presentation and we'll get started. Okay. Can someone please let me know if they can see my PowerPoint?
We see it.
Good deal. Okay. So let me give a little disclaimer before I get started. I am going to try really, really hard during this public hearing to not have you guys eating alphabet soup. We use a lot of acronyms, and I apologize for that, but I'll try my best not to use those acronyms during this presentation. But one thing I want you to know before I start the formal presentation is that The Coastal Regional Commission is the area agency on aging, and we are an aging and disabilities resource connection. So you might hear me throughout the presentation say Regional Commission or say AAA or say ADRC, and they are all one. So that's all one organization. Now, what I will say, the sum or whole of the area agency on aging is an aging and disabilities resource connection, but the Regional Commission is larger than just the AAA. While they are the area agency on aging, they provide other services as well. So under the Regional Commission's umbrella, we also have transportation services, and we have GIS mapping and planning and local government. So the Regional Commission is more than just the area agency on aging. So you might hear me say Regional Commission, AAA, or ADRC, but I'm going to try very hard to not use so many acronyms. So this is the mission of our area agency on aging. We work to foster the development of a comprehensive coordinated system of services which promotes the independence and well-being of coastal area older adults, those with disabilities, and to provide those individuals and their caregivers with information and access to needed services. Now, that is a big job, and we take it very seriously here. And the work we do every day is towards this mission. Now, the purpose of the Area Agency on Aging is to assess the needs of older adults and caregivers and individuals with disabilities in our community. And then we want to plan for and be able to develop and maintain a coordinated, comprehensive service delivery system. We work hard to make sure that we're coordinating services for older adults and individuals with disabilities and their family caregivers to make sure that we're working to meet their service needs. We try to fill service gaps that we identify in our region, and we try to avoid duplication of services. It's our responsibility to be good stewards of the dollars that we receive from the feds and from the state, and we work hard to try to leverage those dollars to effectively meet the needs of the individuals in our community that we're trying to serve. We do some direct service here out of our office, but most of the services that are part of this comprehensive coordinated service system are delivered by our partner organizations that we work with every day. We contract with a number of service providers throughout our 9-county region to provide a number of services to the clients that we serve. So a lot of our responsibility at the Area Agency on Aging is to make sure that we're providing those providers with funding, but also technical assistance. So we monitor and evaluate those service providers to make sure that they're providing services in a way that meets the state and federal guidelines and in a way that effectively meets the care needs of the individuals that we're serving. We also work with our community partners and stakeholders to develop new resources. We work hard to identify the resources that are available in the community, and when we identify a need for a resource that's not available, sometimes we work to be the solution. That's part of the work we do as an Aging and Disabilities Resource Center, but our primary function as an ADRC is to be that access to services for individuals. We used to call ourselves a one-stop shop. I don't like that as much because it's hard to meet every need for everybody. We work hard to do that. I think of us more as the gateway to services. But we're basically that access point. We want to be the entry point into the service system for individuals to be able to come to us and us be able to assess their needs and help them access the services and resources and programs that are out there in the community that will help them to be able to live independently and take good care of themselves and live healthy and safe lives. So that's a big job. And so we don't go about that all willy-nilly. In order to be able to do that work and be able to do it well, we have a plan. We call it our area plan. It's a 4-year plan. And we are right now in year 3 of that area plan 4-year planning cycle, but it's an actual written plan. The document is, I think, 200 and some odd pages. It's available on our agency website if you need something to read to help you get off to sleep at night. Then you might want to pull down that area plan. But what it really is, I call it our roadmap. It guides us in the work that we do. And so, it's required through our Older Americans Act. It spells out what we're trying to accomplish as an area agency on aging in our 9-county region. It includes the goals and objectives that we're working on over a 4-year period of time. It puts the action steps, it lays out the action steps for how we hope to go about accomplishing those goals and objectives. And so it is essentially the map that guides our work over a 4-year period of time. So as I mentioned before, it is a 4-year planning cycle. We are in year 3 of that planning cycle. It began on July 1 of 2020 and it goes through June 30th of 2024. And so as part of the planning process for writing our area plan, we gather input from the community. We conduct needs assessments. We review projections, population projections. We conduct public hearings. We survey the clients that we serve. We gather input from our stakeholders, our partners, and our partner agencies, all as part of identifying the gaps in our service area. And we use that information to help us write our area plan. Also part of that planning cycle is putting our services out for bid. I had mentioned that a large majority of the services that we offer in the region are delivered by our partner organizations, by service providers that we contract with. And so to select the provider agencies that will work with us during the 4-year cycle, we have to go through a RFP process. So we put it out for bid and we request that service providers submit proposals explaining to us how they would work with us over a 4-year period of time to deliver services to our clients. And so then when we receive those proposals, we review them, and then that's how we select the service providers that will be awarded the contracts to work with us over a 4-year planning cycle. So because we are in year 3 and quickly approaching the final year of the planning cycle, we are gearing up for that RFP process. So we will be requesting proposals in the fall of next year. So I talked a lot about the fact that we deliver a number of services and have a number of programs. Here is a list of some of the many services that the Area Agency on Aging either provides directly or provides funding to a service provider in the area to deliver the service for us. I would like to point out that there is a new service that we're adding this year, and that's dementia care services. And we have a new position, which is the dementia care specialist position. And that individual is responsible for developing and implementing a dementia care plan for our region. So we don't have that plan yet. We just hired the dementia care specialist, so that work is underway. We do have a statewide plan, but I'm very happy to say that very soon we will have our own regional plan that is specific to our 9-county area. So yay, we're very excited about that work that we'll be doing the end of this year and the beginning of next year. And the funding that we've been awarded for that position and for those services or program should be ongoing. So that's good news for our region. Good news for the state of Georgia. This is a continued list of those services that are delivered in home. We continue to have information and assistance services done through our office, as well as case management services. We have 2 case managers on hand, and we have a number of case management programs. We still have our hospital transition program, which helps individuals who are transitioning from a hospital, acute care back home. It provides them some case management and some assistance and support to make sure that transition is successful and to avoid being winding back up at the hospital. We also have a care consultation program that provides support to individuals with Alzheimer's and with caregivers who are caring for individuals with Alzheimer's disease, and that's a telephonic program. So the way that the Area Agency on Aging, Coastal Area Agency on Aging, goes about funding our counties is parallel to how the state funds the different AAA regions. When we are determining how many dollars will go into each one of our 9 counties to provide service, we take into account the population of older adults that live in that particular county. And we also look at how many of those individuals are older adults and how many are what we call the old. Those are individuals who are 75 years of age and older. We also take into consideration how many of those older adults are minorities and how many of them are low income. We also consider how much of that county's senior population is rural and how much of that senior population is disabled. We also take into account how many older adults live in that county who have limited English proficiency and who are living alone. And so all of those are factors that carry weight in determining how much dollars we allocate to each county to provide the various services that we talked about on previous slides in the presentation. It's a pretty complicated formula, but that's why I have Marcia. That's why I have a fiscal analyst here to help me with all of that accounting. So our budget for next fiscal year, for fiscal year 2024, we haven't gotten the official allocation, but the budget should be similar to, if not identical to, our current year's budget. So we're hoping to receive the same level of funding for 2024 that we have for 2023. Now you can see here on this slide that our annual budget is $8,979,755. That is about it's almost $3 million more than what our core budget typically is. Usually we have about a $6 million budget a year for services. The reason why our budget is considerably more this fiscal year than what we have traditionally had for services is basically COVID funding at work. And so our budget for this year and next year should be at this level. And that almost $9 million budget is primarily, more than half of it is federal funding. You see 64% of our funding is federal, 30% is state funding, and about 6% comes from our local counties and cities. And I had mentioned before that we contract out quite a bit of our service dollars to service providers in the area. So this is how that funding is split. About 79% of our almost $9 million budget is contracted out to various service providers in our 9-county area to deliver services, and we keep about 21% of the funding in-house. Now, that's not to say that 21% of our funding is spent on administration. We have a number of staff here at the Area Agency on Aging. In fact, most of the staff here at the Area Agency on Aging deliver services directly to clients. We have 6 ADRC counselors who do assessments by phone and provide information and referral to individuals who are calling us and seeking services in the community. We have 2 intake workers. We also have a resource we have a part-time person who maintains our resource database, who is also helping us to identify local resources that can and programs that can help individuals who call us for help. We also have a dementia specialist and 2 case managers. So a great portion of that 21% that's kept in-house is not for admin, but for direct service that the AAA provides directly. As I mentioned before, our budget this year and next year is considerably more than what it traditionally has been in the past, and that's because we have $2,834,015 of coronavirus response funding through the American Rescue Plan. And so this funding has been provided to the area agencies on aging to provide additional supportive services to older adults and individuals with disabilities, to also provide support to family caregivers, to do some health promotion and to provide some nutrition services. This funding, we're using some of it this fiscal year, but the dollars can roll over and will roll over into our federal fiscal year next year, and we will probably have some available even beyond that, because the dollars are scheduled to expire in September 30th of 2024, but it's very likely that we'll get a one-year cost extension on that. So it's a big pot of money, and we're glad to have it, and especially glad to have some additional time to spend it. And that concludes most of the informational part of my presentation. This is my contact information. And I just noticed I've got my old phone number on the slide. So let me give you guys my new phone number if you're trying to call me directly. That email address is correct, but my new direct dial number is 912-541-1615. That's 912-514-1615. Sorry about that. I didn't realize I still have my old phone number on that slide. Now, before I move into some of the questions that I have for you guys, for you to give me some input, I want to be able to open the floor to see if there are any questions about the presentation I just went over. Are there any questions? Do you guys need any clarification on any of the stuff I just went over?
Will you provide these slides to those of us attending today?
I'm sure. I don't have any problem sharing the slide deck. I can do that.
I thought it might be a great resource for all of us to have access to. Thank you.
What I'll do, if you don't mind, what would probably be easiest for me and my team, we're going to post the recording from the public hearing to our website. So I will also post the PowerPoint to our website. Would that work?
Perfect.
Great. So those of you who are interested in having it can go and access it from our website. Any other questions? Okay, hearing none, I'm going to move into some of our discussion questions. So what I would like to hear from you.
I believe there's a question.
Oh, is there a question in the chat? I'm sorry.
Yeah, she's muted. Give me one moment. Let me unmute her.
Thank you.
I don't think she's gonna have to unmute herself. Unmute yourself and you can ask your question.
Okay, can you hear me now?
Yes.
Yes.
All right, thank you. Thank you. I have a friend, she's a senior, around about 80, and she's alone. And she needs someone to be able to take her to the doctor and to the grocery store and things, and to senior meetings. And so I split up my time most of the time and take her. Is there any way that she can get help through this organization, so that I don't have to take her all the time? I am busy too. I have a strict doctor appointment time. I have lots of them, and sometimes it's inconvenient for me to work my appointments out and to work her appointments out and things like that. I live in Kingsland. She lives in St. Mary's, but we're just about 8-10 minutes apart.
So yes, we provide transportation services, and it's at a cost, but it's subsidized with our state and federal funding. And so it's $5 one way, $10 round trip. So she could use our transportation services to do a number of the things that you were just describing. And so it would just be a matter of her calling our transportation department to book the trip, we do require at least 24-hour notice. And it is based on the availability of a vehicle. But yes, we do have transportation services for the type of transportation that you were describing.
All right.
Now that's
Thank
a different number from our 1-800 number for the Area Agency on Aging. So let me give you that number.
Okay.
And in fact, I'll put it in the chat as well.
Oh, okay.
Because
Thank
it
you.
is a different number. It's 1-866-543-6744.
Six, seven, four.
Yeah,
Okay.
and I'll put it in the chat as well. Okay.
Thank
Any
you.
other questions? You're welcome. Any other questions?
It's not a question, Pam, but there is also a resource in the chat from Dr. Chandler in regards to the coastal health, also offer vouchers to patients coming to their clinics for appointments. Not sure whether that is of some help to that particular individual or not.
It could be, because I think, if I'm not mistaken, that we are providing some services in the Chatham County area, certainly if they're wanting to come to the clinic in Brunswick. But I also think that we're working on a partnership to do some services in Camden County as well. I'm sorry, I say we. I'm talking about Coastal Community Health, because I also sit on their board. That's why I said we. It's really Dr. Chandler's team over at Coastal Community Health.
You're correct. Good morning. Yes, ma'am. We have some funds set aside to help support the cost, so we can help pay for that voucher in some situations where individuals need help. And we do have a clinic opening in St. Mary's in January. So yes.
Great. Thank you, Dr. Chandler. I was hoping I wasn't mistaken in that. So.
No, ma'am, you were correct. Thank you, guys.
Okay, so I was, were there any other questions about my presentation before I move into the questions that I'm hoping to get some insight from the group on?
Hey, Pam, this is Jill Costello.
Hi, Jill.
Hey, I was just curious, is there going to be some of a rollout of that dementia program? I'm anxious to learn more about that.
Well, Jill, we're in the early stages, so we haven't put pen to paper yet. But I think it's fair to say that there'll be some type of rollout once we get the plan drafted. But it's so early on. So what I should say about the dementia care specialist position is it's new to Coastal AAA, but it's new to the state of Georgia. So legislation was passed earlier this year that secured funding for each one of the area agencies on aging in the state of Georgia to have their own dementia care specialist. So Mari Battle is our dementia care specialist here in Coastal, but she is one of 12 that are working across the state to help put the statewide dementia plan in motion. And there is also a team lead at the Division of Aging Services in Atlanta at our state office. There's also a team lead who is a dementia care specialist as well, and she's helping to lead this project and work across the state of Georgia. So it's much bigger than Coastal, but yes, I imagine we will have some type of rollout of our regional or local plan once we get it drafted.
Nice. Looking forward to it. Thank you.
Yeah. And I'm sure that we'll be working with your agency in some way as well with that, Jill. I'm sure that we'll be working with a number of the service providers across the coastal region who are working with family caregivers.
Awesome. Thank you.
Thank you. I appreciate the partnership. Any other questions? Okay, so my first question for discussion was I wanted to hear from you what you think are the most important services for older adults in our community. And I also want to hear what you think are the most important services for individuals with physical and developmental disabilities in our community. So I just want to open the floor up to you to give us some input about what you think are the most important services. What do you think are additional services that are needed in our area? This is your opportunity to give us some input on that comprehensive plan that we're putting together for delivering services. So don't be shy.
Hey, Pam, this is Cassandra Palmer with Brain Injury Association of Georgia. I'm not sure if I really am the best to put this out here, but I just thought I wanted to share that BIAG, we have been receiving an increase in panic calls for rent increase assistance. And then always for us, it's been finding assisted living centers or places for those with brain injuries and applying for Medicaid, Medicare, SHIP, that kind of thing. Those are our standard calls where we usually have to tap you all. Jane, would you agree?
Oh, I absolutely do agree. And there's, then it just follows behind what Cassandra just mentioned, with all kinds of needs from the transportation to financial.
And would you say that has been consistent over a period of time? Would you say it's increasing? Has it changed in any, or have your client's needs changed in any way? And if so, what are those changes?
Yeah, that's why I brought it up. It seems like in this last month and a half, we have the calls have shifted from our usual looking for assisted living or, Medicaid. Those are standard calls. But what has changed is this request for help in finding rent increase assistance. That seems to be new, as well as like homes where there were assisted living and they were someone with a brain injury, and now the homes are now turning to like apartment homes and no longer the assisted living centers. That's another situation we're running into.
Okay, and you're in the Savannah area, correct?
We run for the full state. So
Okay.
we're seeing it in pockets, definitely Metro Atlanta, but pockets all over the state.
What I'm hearing from my counterparts around the state, which is the same thing that we're experiencing throughout the coastal region, is the homelessness issues amongst our population are on the rise. I mean, we've always had some housing issues with our clientele, but now more than ever, we're dealing with our clients who are not just needing rental assistance, but not just needing house, but they're homeless. And I'm hearing that across the state.
Yes, we're having that too. And we had actually, this is terrible, but we had a report over the weekend from Brain Injury Association of America. They received a call, and it was one of our people we've been trying to reach out to the last couple of years, and they were homeless and they took their life over the weekend. So yeah, this is becoming a thing. So that's why I thought I'd share it. So maybe home assistance, home rental assistance. Right now seems to be the big request we're getting, which is unusual for BIAG, I guess I would say.
Well, I think they're just calling everybody now because it's just become such an issue.
Oh, I agree. I would agree with that. A lot of calls that I get are routing through the ADRC tree, and they're not brain injury. They're just needing help. They're needing resources. And they're punching buttons till they find somebody that answers the phone.
Okay, does anybody else want to weigh in on what they're seeing to be the emerging needs or the most emergent needs of the clients you're serving?
Hi, this is Patty. Can you hear me okay?
I sure can.
Okay, I've been having speaker problems, that's why I asked. We're seeing a rise in homelessness as well. I wish we had some flexible funding to provide services to people that don't have an address. Because they're coming to us already in their truck or their vehicle. And we do try to help. We absolutely are like walking with them and helping them find a place, but particularly in our area, affordable housing is at a critical, it's at a bad impasse at this point. So just throwing my 2 cents in for that.
Well, I think that's a good point. I do feel like that's something that we could start working on sooner as opposed to later, is figuring out a way to, homelessness should not become a barrier to us being able to provide a service. And so I agree with you. Well, that's something we can put our heads together, I think, and tackle and figure out. What else are you seeing going on with the folks you're serving?
Asking me?
Oh, all of you.
Everybody?
but you as well, Pat. To
Um,
contribute more than 2 cents. You can put in more than 2 if you want.
How do you raise your hand?
This is Jackie Ogden in Savannah with UGA Cooperative Extension. And the calls that we get on housing, of course, is definitely one that's concerning, as several of you have mentioned. But one place, too, that we also encourage consumers to use is GeorgiaHousingSearch.org, which is tied back to the Georgia Department of Community Affairs. And that's listed by zip code so that the consumer can actually find what is available, the price range. It's a free service and it's statewide. Many of you probably already use that, but I just thought I would mention it. The other topic in financial education through Cooperative Extension is we do have some classes, one in particular, How You Spend Makes a Difference, and working with people on developing their spending plan. Hope that might help.
Thank you, Jackie.
There's also someone who has their hand raised. Paula?
Yes, this is Paula Ruling from Goodwill of Southeast Georgia. Can you hear me okay?
Yes.
I want to thank you for adding the dementia services. They're not our number one call, but they are getting more prevalent and the needs are more desperate, I guess I would say. There's difficulty finding services. And of course, we serve as an information and resource center because we don't actually have direct services for people with Alzheimer's because we are workforce development and employment. But I also wanted to say that we have vouchers for anyone who wants to come to one of our career centers. And we have job development and for all ages. For the longest time, we seem to only serve people up to, so let's say 60, but we have 72-year-olds going into the workplace now. So that falls under aging, I think, and they are doing so successfully. So we gather resources, and if you have any resources that you think that we might not have, please feel free to send them to us. We also have the SNAP employment and training programs, and in training, our clients get paid a training wage, which is only $7.25, but they're often hired into jobs right away at $15 an hour. So if you have someone who is stable with their basic needs and trying to get into employment, we are very happy to help. But also, I wanted to let you know I'm very excited about your plan and I think that adding the dementia services are very good.
I want to thank you all who are sharing resources. Thank you for that. I think that's an added bonus that we're all together here and we've got a lot of mutual clients. So I appreciate those of you who are chiming in and sharing resources. I personally know that my case managers from my organization are on this virtual meeting, and I'm sure they're busy writing down all the wonderful resources you're sharing. So I appreciate you sharing that information. Thank you. And when you mentioned vouchers, did you mean for transportation to your career centers? Is that what the vouchers are for?
We have clothing vouchers, $20 per person, $40 per family, and that's usually for our consumers or our clients who are trying to get into the workplace. But for a specifically hard-stressed family, we can usually find a way to get them those vouchers. We also have the support services of gas cards, bus cards, Uber cards for people who are getting to. These are specifically for people who are coming to our services to get help with preparation for employment or getting placed in employment. And for those people, we also have support services of helping get uniforms and work boots. There are a few programs where we pay for certifications. We have a forklift certification program where we pay for them to have their final certification at, I think it's Savannah Tech. So there are a lot of different support services, and unfortunately they're divided up into different areas. So not all services go for all people, but we do have clothing vouchers, and we have transportation vouchers. And like I said, those are mostly for people who are coming to our programs to get services. But for a family who's fallen on hard times, any kind of emergency, we try to get around that and at least get them a clothing voucher. So I'm going to put my information in the chat. Feel free to call me or email me if you have any questions, and I'll do whatever I can.
Thank you. Okay, I have a few more questions. I'm going to move on to those questions unless there's someone else who wants to weigh in on what you think are the most important services that are needed in our area right now for the clients we serve, or what do you think are new or additional services that need to be added? Going once, going twice. And I'll say again, if you're having some difficulty with your audio, or you just prefer not to speak up at this point and you want to send us written comments, I am going to put an email address up at the end of the presentation again that you all can use to send written comments. Or if you just think of something later that you wish you had said, there will be an opportunity to still give us feedback for a couple of weeks after the public hearing, because we just want to make sure we're reaching as many people and gathering as much information as we can. If you have staff people who've missed this public hearing, we're going to put the recording up too so they can watch it and then later send us their comments.
It looks like Darlene has her hand up.
Hi, can you hear me okay?
I can hear you now.
Hi, this is Corina Ruiz. I'm the option counselor with the Coastal Area Agency on Aging. I just want to add something. I noticed that a lot of residents, they need personal hygiene supplies like pull-ups or adult briefs, toilet paper, paper towels, stuff like that. That right now they're very expensive for them, especially with low-income residents or elderly who are in community and they live on Social Security incomes. So I don't know if there's something that can be added the services that are provided, like personal hygiene supplies. I think this is one of the needs that they have.
That's a good point. We used to annually here every year do a food drive at Christmas time. And we'd also collect some, personal hygiene items as well. Household items like paper towels, toilet paper, washing powder, things like that. We did it once a year around Christmas, but what we found is that everybody, I won't say everybody, but many organizations were doing the same thing around Christmas time. And so over time, it was a lot of work. So over time, we got to where we just stopped doing it. But I wonder if maybe that's not something I could work with some of our coalitions on, doing a personal hygiene or paper drive some other time during the year to collect these items that we could then provide to our partner agencies so you could get them out to the clients you serve.
Yes, I'm sure anything will help.
But I also think, we are able to use some of our funding for material aid. We tend to use it for assistive technology, for devices that help individuals, but under material aid, it could be used for some of the type of items that you were talking about as well. So those are just a couple ideas that came to me just when you mentioned it, but I'm sure we could come up with a lot more. So yeah, I think that's something we can work with you on. Definitely over next fiscal year to make sure we get that, some funding set aside for that, or some project set aside for it.
Thinking of briefs, adult briefs, very expensive.
We do, Karina, do some incontinence supplies already. We do some of that. So we do have some programs where we're doing that through. So you can contact our ADRC, you can contact one of my case managers, or my case management supervisor, Mari Battle, and she can tell you about some of the programs that we have that do provide some funding for material aid for nutritional supplements and incontinence supplies for some of our clients.
Thank you.
Okay.
There's a couple people with their hands up. Darlene, did you have did you have a question? And then Jacqueline also has her hand up.
Hi, this is Jackie Ogden with UGA Extension. I just wanted to mention for the nutrition education outreach that might be needed in your county, you may want to reach out to your local cooperative extension office. That would be UGA Cooperative Extension in your county. There may be a family consumer science agent in that county, or we do have resources readily available that you can use. So just check with your local county extension office.
Okay, I'm moving to my next slide. A couple more questions. So, what are challenges that older adults and adults with disabilities and their caregivers face in finding and accessing services? So, what are the barriers for our clients to accessing services? And how will our services need to change in order to meet the needs of our future elders?
Neil has their hand up.
Hi, Neil.
Hey, everybody. I know that one of the challenges that we're running into is we do a lot of nursing home transition, which I know you guys also participate in. And it's getting scarier and scarier to get people out of the institutional setting because that's a suboptimal place for them to be. But we know that they have care, and with the lack of home health not showing up, trying to identify other resources in the community. There's a lot of, I mean, we had somebody who was hospitalized because they didn't take their meds for 3 days. I think that one of the things that would be really helpful for us would be to run a joint advocacy campaign with the ADRC to try to help identify who we need to be talking to. One of the biggest challenges we're seeing now is when we transition people out, that we can't apply for a waiver until they're out. And so we're doing bridge services for about the first 3 to 4 weeks, and that's eating our budget. So things like this, I feel like as an institutional kind of player in this space, it would be really helpful for us to find other partners who would kind of aggregate our voices so that we could get people to listen to us, because we've been screaming about it. I know home health has been screaming about it. I know some of it is just compensation. The rates are low, but we have to figure something out. I mean, it's terrifying to get people out and not know how they're going to get care. So I'd love to pick you guys' brains about that. And I'd love to kind of open that up to the group as well to see if anybody has any thoughts or ideas about how we can make that work.
Let me ask a question, because things may have just changed or may not work the way I used to remember them. But when someone's coming out of an institutional setting and you're applying for a waiver, are there not providers that are willing to start service before the waiver is approved? I know, because they can be paid back retro from the application date if the person gets successfully enrolled. Now, I know if they don't get successfully enrolled, then it becomes an issue. It used to be the client liability to repay that. So do we still have providers in the network that are willing to start that service on good faith while we're going through the enrollment process for the waiver, or has that pretty much dried up?
I can't speak for lived experience in this space because I know I'm getting it all filtered through CT when he's telling me about it. But he's reporting that to get the services started, these guys start checking out invoices the first week, and we end up eating them until waiver services. He's never, to the best of my knowledge, tried to claw back based on waiver qualifications, them qualifying for the waiver later. So we can look into that. But it's restricting what we can do, because with an MFP budget of 20,000, you have some wiggle room, but it's legitimately taking 2 months to get waiver services in place on some of these occasions. And so we're going through $5,000 to $8,000 potentially in that span of time.
And we could maybe at a minimum help facilitate that conversation, to see if that's not something your clients could still be taking advantage of with providers. I think we can help you facilitate that conversation.
Perfect.
To get the right people around the table.
That'd be perfect. Thank you very much.
It looks like Dave has his hand up also.
I do. And this is to follow up a little bit on Neil's conversation. I'm Dave Lamb with CareMaster Medical Services. While our corporate offices are in Griffin, Georgia, we're a statewide provider. We actually do private duty home care in the state of Alabama and have been in South Carolina as well. So we have a lot of experience all across the state and in other areas too. One of the things that goes unmentioned and leads to Neil's comment is the workforce shortage that we're experiencing. Right now, studies show that 85% of home care providers are turning down cases because of lack of staff. It occurs to us and it occurs to others. Now, I'm also the chairman for the legislative affairs for the Home Care Association of America, the Georgia chapter. And we have worked with the General Assembly, and they have been favorable, provided home care providers enrolled in Medicaid elderly and disabled waivers a 10% increase roughly 2 years ago that was just effective last year. And then last year, a slight increase to help with the cost of fingerprinting. Many of you may already know that there is a rate study going on for all elderly and disabled providers that are involved in home and community-based services. But what we are seeing is rates that, for instance, if our industry wanted to average a $15 an hour pay rate, the reimbursement rates need to go up $6 an hour or more. So that's a heavy lift. We are working with other associations and be working with the legislature, hoping for an additional increase this year and a commitment to bring the rates up so that we can increase pay rates and that we can assure that our industry is profitable as well. So there's a lot of work going on, but workforce in healthcare, all through healthcare, is very challenging right now, but there's a lot of other workforce challenges as well. So this is a very difficult subject. Now, Pam, I would be willing, matter of fact, yesterday I was at the River Valley AAA Advisory Council. I met with them and presented some workforce issues. I would be glad to do the same for y'all. I think it's very eye-opening as to what our industry is seeing. And we're in the process of surveying our industry right now to get new and updated information. But I'm involved with the process. I am chairman of the advisory council for the Three Rivers Area Agency on Aging, and also involved in our Three Rivers workforce development. Those are areas that our community, not just providers, but the entire community needs to be working on doing things to improve workforce. One of the things that we see that really helps is college and career academies and their relationship and working relationship in particular with the technical college system of Georgia. There are now at the Griffin Region College and Career Academy apprenticeships that CareMaster will be participating in for CNA students. That normally those apprenticeships and those clinicals were just involving skilled nursing facilities or hospitals, but that has been broadened to include home health and home care. And I think that's big for our industry, but we've got to find caregivers and nurses that have the heart to serve the elderly and disabled community. And that community totals almost 2.7 million Georgians. And right now there's 1.8 million Georgians that are receiving some type of care in their homes. Now, the vast majority of that is provided by family and friends, but well over 400,000 Georgians are receiving paid care in their homes. Then that's provided by a nurse or a caregiver. So there is a need and there's an unmet need. Those numbers don't include everybody that needs our services.
I couldn't agree with you more, David. It is a huge issue, and it has the workforce shortage is having a impact on the work that we do here at the Area Agency on Aging. We have some additional dollars due to COVID, and we're finding ourselves in situations where we're identifying providers that we can pass those dollars on to, because they have clients who need the service, and then the client doesn't get the service because the provider then can't find an aide or find staff to send to that client's home. And so it's been a problem that we've been working on a local level on. We've been working on a statewide level. It's also an issue that we've been trying to work on and tackle from a national level as well. And we still haven't come up with the solution to the problem. So yes, I'd be very interested in having you come and do a talk in my area. I'll certainly work with you to schedule time for you to speak with my advisory council. But I think that maybe even a broader audience here in Coastal could benefit from some of the information that you shared today, and certainly with a deeper dive into that information, because yes, we're definitely feeling the impact of the workforce shortage, and we are seeing that it is putting our clients, our very vulnerable clients, in very dangerous situations.
Pam, I will put my email in the chat for you.
Thank you. Thank you.
And be glad to help any way we can, and especially to educate the legislators at the local level. Going to Atlanta, and I have a meeting in Atlanta at the Capitol next week, and we're there on a regular basis. But certainly the ability to meet with folks in their districts where they hear from their residents about the kind of issues that are involving them. So any way I can help, I'll be glad to. And we have plenty of resources for information, actually at the county and region level as well.
Thank you.
Dave, I would like to talk to you. Goodwill of Southeast Georgia covers 23 counties. This subject has been coming up all this year since January in ADRC, and I've done a great deal of research. And I would like to have specifically the kind of educational program that you mentioned as part of our SNAP education and training. And we are getting requests for that training, but the part we are missing is hooking up the people who graduate from the training to specific jobs. So if you have time, I would like to contact you and have you help me with that part, and then we can become a part of hopefully that solution in our area in the 23 counties that we serve.
Okay, well, as I said, I'll put my email in the chat. Anybody that I can be of assistance to, please don't hesitate to reach out. I have a passion for this. obviously, I know you mentioned the more elderly above 75. I'm one of those too. So I feel very involved, and I see the need. And so, yes, I'm glad to help any way I can. So I will move to the chat and put my email there. And please, anybody that needs some help or information, feel free to contact me.
Thank you very much for doing that. And just one final point, I just want to point out while we're doing this, the importance of building consensus around all the different silos, because if we raise the rate for reimbursement in the community, but don't do it with respect to the people in the nursing homes, all you're doing is you're pulling the workers out of the nursing homes and then moving them into the community. And so you're going to have shortages there. So we need to make sure that we're doing that collectively across both the home health as well as in the nursing home setting.
Neil, you're absolutely right. Right now, though, if you look at BLS data, there is a gap of $3 to $4 an hour in Georgia between what home care is paying and what facilities are paying. So, but yes, and one of our goals that we're presenting is that all waivers ought to have the same relative reimbursement rate. So as you say, we're not pulling caregivers from one industry to the other because there's a higher reimbursement rate. You know, we've got to take care of all those Georgians that need our help.
Right. And I think that's just good common sense, David. The service costs what it costs. It shouldn't change. The reimbursement rate shouldn't change drastically depending on the waiver. It's the service costs what it costs. Otherwise, you're jeopardizing the quality or even the availability of the service.
You're absolutely right, Pam. Thank y'all.
Thank you. So what are other challenges that we're facing, or what are other service, other changes that you feel need to happen in our service delivery system for us to be more effective in the work we're doing every day? I never thought I'd go through a public hearing where I wouldn't be beat over the head with the need for transportation. I know it was mentioned, but I mean, usually it's I think transportation is still a major issue for the clients we serve. I just think now there are so many more emergent issues that we got to spread our efforts out over all of these gaps. But are there other challenges that you want to talk about today for our mutual clients? Are there other needs that changes that you'd like to see happen with regards to the work that we're doing here at the Area Agency on Aging?
This is Neil. I'll just one more kind of a broad scope issue. We see it with respect to the people. Thank you, Dave. We see it with respect to the people that work, my coworkers, as well as the people that we work with. The limits on assets basically confine people to poverty for their entire life. Like, you can't save money. And so when something happens, which it's going to happen, you don't have any way to get out of that situation. So we're creating a culture of dependence, and then people are going to blame the individuals who are suffering from that for the disease of a sloth, basically. And that's the furthest thing from the case. But if you're risking losing your insurance, I know the Ticket to Work's available and things like that, but there's I think having an honest conversation with some people about, if you go and try to do this and you lose it, that you may not be able to get it back, and what that means to people, and making sure that people understand the policy implications of this. So the Ticket to Work programs and those sorts of endeavors are the right idea, but trying to get it built out a little bit further, because you can't buy a home. Like, there are just limits on what you can do that don't make sense, because they're going to end up saving the public money in the long haul. and they're going to empower people to be able to make decisions about how they want to live, and you get better outcomes when you do that. So that's a broad picture thing I would like to see us in the background continuing to work, because that's a multi-generation argument that you're going to have to make. But I'd like us to at least be making people aware of the unintended impact, the unintended costs of these policies.
That's a very good point, Neil, and I think that was well said. We want the programs and the services that we provide to truly help people and not become a barrier to them improving their quality of life. So that's a good point. Anybody else? I think we've had some really good dialogue. You guys have provided some excellent input and shared some really good resources. I don't want to keep you here any longer than this process takes, but I do want to give you all an opportunity. If there are some other things that you want to share that may not be relevant to the discussion questions, this would be the time to do that. Okay, well, as I mentioned before, we are recording the public hearing. We will post it on our website, so you'll have the opportunity to view it at a later time, or have some of your coworkers or colleagues view it. You'll have several weeks to continue to provide us input via email. Thank you, Patty. Certainly encourage you all to share it if you have the opportunity to share it with some of your clients you serve, because we're hoping to hear from the public, the clients we serve, future clients, the providers who are working to serve those individuals. All of those individuals are important, and feedback from all of those entities is important as we develop our area plan and we do our final update for next year on this 4-year planning cycle. So let me put up, before we close, here's an email address for Latrice Burnett. She's our she's our administrative assistant. You can send comments via email to her. Please make sure in the subject line of your email that you put public input, so that we make sure we capture all the comments that are relevant to this public hearing. I think we're also going to post on our website a form that can be used to provide input as well, as you're sending it over. But you're certainly welcome to just send us an email with the subject public input. And so if there are no additional questions or comments, then I am going to close the public hearing. And I thank you all for your time, and I hope you enjoy the rest of your week.
Thank you. Happy holidays, everyone.
Thank you.
Thank
Great
you.
job.
Bye.
Thank you.
Great job.
Thanks, guys.